looks like we have our full team here at Quizzify. I'm just going to share my screen now and bring up our presentation to get this ball rolling here in a couple minutes. Thank you all for joining us today. Our webinar today is about auto Quizzify, and this is kind of an evolution of our product, so that we can address advisors that have smaller groups and want to continue to add on another group. We want to make that as smooth as possible. And in pursuit of that today, I'm joined by our CEO, Al Lewis, who most of you know. And as in case some of you are new, Al is recognized as one of the foremost authorities on wellness and population health. He's written books about wellness outcomes. He's written books about designing better health plans. Back in 2013, Al was writing about better pharmacy benefit management, better medical management, centers of excellence programs with and also Peter Prosel is joining us, and I'm going to be turning over the conversation to Peter. Peter's our Chief Technology Officer. We've all been working with Al for more than 5 years, and what we have to show you today is pretty cool. So thank you all for taking time out of your busy day to join us. And our agenda today is to start with a little bit of a reintro on Quizzify that's just going to take a couple minutes. And then Peter is going to take up the conversation from there to actually give you a demonstration of what we're calling auto Quizzify. And Al is going to wrap with showing everyone the other part of Quizzify, which is our mobile app, the Doctor Visit PrepKits, and our ER, what we call our ER Prevent Consent, which keeps most ER bills over under $1,000. And then we'll describe a little bit more about the pricing and how it differs from the full version of Quizzify. So I'm just going to just quickly start by just reintroing what Quizzify is all about. Our business is about pursuing the problem of poor health literacy. More than 80% of US adults, working age people, are considered health illiterate. And that means that in general, they're not understanding or appreciating their benefits. They're paying too much of their own money and the plan's money when they go into the medical marketplace. And they're often pulled into a lot of unnecessary and potentially harmful tests and procedures, which are really rampant in today's medical marketplace. Now, the way Quizzify goes about doing this, and this is our product that is also part of auto Quizzify, and that you can look at is in two parts. And the first part is our engaging quiz format, which all of you pretty much know who Al is, but this is Al in his earlier years when he was on Jeopardy, and he puts a lot of trivia and humor into our quizzes. And we also have Harvard doctors reviewing our medically oriented content. So the quizzes that we serve up once a month are one part of Quizzify. The other part of Quizzify is a mobile app we call Quizzify to Go. And there's two parts of that. One is a strategy that's educational in nature that keeps ER bills under $1,000 that Al's going to be elaborating on today. And then the other part of Quizzify to Go is 188 odd categories of specific categories of doctor visits. And if they're designed to empower people so they make the most out of a doctor visit and they don't walk out of the doctor's office thinking, oh my goodness, I should have asked that question. So that's just a quick review of what we do. And now I'm going to turn over my screen. I'm going to stop sharing, and Peter Prosel is going to show you the latest on auto Quizzify.
Okay, thank you, Mark. So hello all. So, let me just give a little bit of the intention behind what we're about to show you here. So, we mostly started with individual clients, and it was essentially a single program, single client for many cases, and so they focused heavily on just managing that one program. And we built a lot of different features. for them to do that, and it got somewhat complicated. So then when a couple of months ago we started thinking about how can we exactly allow someone to manage multiple accounts easily, especially if they don't have a lot of time to do so, right? So if they're not able to, you know, spend hours a month or even an hour a month on each client, you know, so we kind of set the goal of, can you have a program in a box essentially? Can you just set up one or two things and have the program run itself more or less automatically for a year or even more than a year? And so that's what I'm going to be showing you today. We sort of boiled down the admin to really just three things. You manage your list of accounts. You know, I put in a few examples here. So this would be, the example here is that I am sort of essentially in your role. I am a broker of some sort or manage multiple companies through a program. And so, you know, I have these several dummy accounts set up here. If I want to add one, I just go through this fairly simple workflow. So I would say, you know, Acme Widget as the company name. And then I just set the number of employees and spouses that the company would have. Let's say it's 500. I'll just adjust that manually. There we go, 500. And then I get a little pricing screen. Now, you know, the thing is, this was meant for doing this quickly. You could do this off of a credit card. But, you know, to be clear, if we have a relationship with you, we would probably work out some, you know, some volume deal as well. So this is really just for the smallest use case where somebody just wants to kind of get up and go, start a couple 50-person accounts the same day and not even bother having to sign a contract or anything like that. And actually, with that, Mark, do you want to give a little bit of commentary on some of our more kind of relationship discounts and so on that we would have?
Yeah, we're gonna save that for you know, the bottom line is it's pretty much $1 per employee and spouse per month, subject to a minimum of 500, and we'll let you add on smaller accounts after that. Now Al's going to elaborate more on that after he shows. We wanted to show you the full product that includes our mobile app. So hang around to the end of the call, and we'll show you a matrix and that we'll be able to send to you as well.
Right. But so again, I mean, the idea here is that someone is just, you know, maybe they even want to just try this with an account or two, and so they can just go ahead, fill this out, and get going. And you know, we have a $500 minimum, but again, that could be further worked out afterwards. But the
$500 a year minimum. So yes,
$500 a year, and so if for example, if you had, you know, let's say you were dealing with a very small account, it's only, let's say 50, you would still have the $500 minimum, but then it would essentially cover what is that, the 10 months of your program, right? So you pretty much prepay for the whole year, almost the whole year. So that's the idea there. I mean, you could set up as many of these as you want. You know, probably a lot of people would just have a handful. But then once you set those up, what happens is that each one gets started with what we're calling now kind of our new standard curriculum. And you can see here, everything's kind of intended for the point of view of a multi-account manager, you know, sort of the owner of the entire umbrella system. So you're seeing already here, there are different companies and different quizzes, but you can sort of zoom in on a company. So you could just say, you know, test company 3, right? And you can get a sense of what our curriculum here is, where there's a launch quiz, which is a hodgepodge of certain things, kind of a general, you know, greatest hits a little bit of a program. There's Quizzify to go. That's something Al will talk more about afterwards, sort of the role of Quizzify to go in all this. That's our mobile app. We have, you know, nutrition, diabetes, gut health, cavities. There's a customizable benefits quiz. That's kind of interesting, and I'll comment a little bit more on that at the end in terms of where our roadmap goes from here. But we wanted to split the difference between sort of having completely off-the-shelf content and having things that are particular to the company. So So you can even do, this is, this is not as customizable as our full products, because that has a very kind of concierge customization service that we offer. But there's still like selective customization that can still make it appropriate for even small accounts and their particular setup. So, it's sort of our standard curriculum, and honestly, you could just leave it and it'll run itself. It'll send out emails to users. It's a program for a whole year. So you could have been done actually before you even got to the screen to some degree. But if you do want to, if some of this content's not to your liking, you can remove them. And we populated an entire panel of, I think it's about 80 alternate quizzes on all sorts of topics. Some of them are customizable for like benefits and so on. Some of them are general purpose. But I mean, this is potentially years worth of content, and you could really just manage it by clicking in a few, deleting a few, and so on. Or you could just leave it as it is, and it'll populate these on an ongoing basis indefinitely. So, again, we're trying to make this a program in a box. I mean, this could be as little as a few minutes of management a year per account, potentially. I mean, the only other step you would want to do is, this could be as simple as taking one of these homepage links and just sending it to whoever the appropriate communications person is and saying, okay, send it to your users, and we're done. And the users would go to that link, sign themselves up, and you don't have to manage anything. If you want to take the extra step, or if one of your designated client admins wants to take the extra step, they can upload a spreadsheet. Well, they can actually populate users individually, but that's a little less efficient. You could also upload a spreadsheet, and by uploading that, you could load the entire company roster in one shot. The advantage of doing that is by preloading everybody, you would kind of put everybody on the schedule of the automatic emails that come out at the beginning of each quiz, and then sort of an extra reminder email in progress during each quiz. So Peter, that could be, if you want to go from 5 minutes to 10 minutes of management a year, you could take the time to upload that spreadsheet.
Peter, we have a question in the Q&A, which is, can we give these setups to management/human resources to add and subtract quizzing as an agency? So
yes, you can. So I kind of set this example up ahead of time to kind of simulate it. But in this construct, I am the broker, right? So this is me, the broker, and I've loaded John and Sally as users. But I've made John a admin of test company. And Sally can also be made an admin of test company. So I can make her a company admin. Oops, sorry, I didn't put in the company. There we go. And there you go. So so there you go. If you wanna just sort of set it up and then immediately delegate it, that's what you can do. You can either create an individual user here, or as part of the upload, flag a couple of them as admins, and you're done. And they can manage, and then they're gonna basically, do the same thing you're doing here, just be doing it at one level lower. So they wouldn't have access to all 4 companies. They would have access to their one company, for example. So, I mean, I'm happy to answer questions. There's honestly, the point of this is that there's not much to it. Let me just give a little bit of color commentary on how things would work after this, first few minutes right here where we're setting this up. So, some of this is done, some of this will be done very, very soon, but either way, by the time you use it, it'll all be done. Basically, our plan for these sort of accounts is to slightly modify some of the emails we already send and turn them into essentially admin digest monthly. So we do have reporting capabilities. There's a lot of stuff you can dig into here. Like you can actually go to an individual quiz. You can look at what kind of questions it has. None of these quizzes were completed, but if they were, you would see scores and improvements in scores and different metrics for completions. And there's even like a full Excel table you can download. But honestly, the philosophy we're trying to follow is that is on a on demand or as needed basis. If somebody wants that, we are happy to point them to it or help them find it if they can't find it here. easily, or they don't know where to look. But what we'd like to do, and I think which will serve almost all use cases, is just send the designated admins and the broker, an end of month, first of the month kind of digest for the prior month, like an account statement pretty much. And it'll just have a kind of pre-made report that shows, who completed what in the last month, how many times they did it, what kind of scores they had, that kind of thing. And that's what almost everybody wants, right? What they actually just want is a simple roster of, did people do this quiz, did people do that quiz? So we would blast that out to every relevant admin every month. And then at the end of the year, kind of package it one higher level to an annual report that sort of summarizes some of the data and has, could be potentially nice to present to to business clients and so on who want some, want a sense of what the program achieved. And so again, so kind of a program in a box. I mean, really minimal setup. You could get down to literally just saying company name and number of employees and never touch it again, if you like. Yeah, look, any questions on any of that so far?
Peter, we had a question on where the 5.3 ROI came from. I'll handle that when I take the baton.
Okay. All right, sure. So Al will respond to that one. Let me just tease two things. I was kind of hoping to have them today, but but I didn't want to rush something into a live demo. But there are two features that are coming very quickly on the heels of this, very much in the same spirit. One is that we have, I would say, a dozen or so, maybe, quizzes that have a kind of a benefits focus. And the idea there is that they're talking about something like, where are the nurse navigators and how do I reach them? So one thing we're going to add to this, to just sort of completely dot every I and cross every T, is a little form, which again, you don't necessarily have to fill out up front, but a little form where you can populate key phone numbers and things like that, like where's the nurse navigator phone number, what's the website for this, for that. And that will just sort of automatically then go into the quizzes, into the sort of slots that were designated for that kind of information. So that way you sort of, with very minimal extra effort, would get essentially a per client customized, benefits educational component to this, about the actual internal benefits of the client. So that's one kind of additional feature that didn't quite make it into today. And another one, which I'm personally very excited about, is because this is really more or less the final thing that most of our clients need to run this program without touching it, is an auto raffle feature. So basically, you just set up a budget, and we're trying to integrate Amazon and Starbucks as a start, but I'm looking whether there's kind of a more general gift card provider that can just let the user select. But basically, just say, okay, let's just set a simple contest rule that says, we're going to raffle off $100 a month of gift cards in $20 increments, and the system will just automatically pluck 5 users and send them the gift card on the first of the month. So once those two are there, then I mean, unless you all tell me, but once that's there, I don't really see what else an admin would have to do based on my experience working with admins on this system.
Okie dokie. So thank you for that. And I'm going to share my screen. And I will show you three more things. First, well, let me see if I can get this first thing going. To answer the question that was asked about the ROI, it comes from the ROI calculator, which is a Validation Institute validate. Actually, I think I can just go roi.quizzify.com, right, Peter?
That is correct.
All right. So that 5.3 comes from roi.quizzify.com. And if you have a small group, it could be 0 or it could be 50. I mean, it's just like, do we avoid one spinal fusion? or does nothing happen? But in a large enough group, at that price, it will be 5.3. This is a higher number because we've, in a large enough group, we put in a few things like avoiding premature birth, for example, that we don't put in smaller groups. But you'll be able to go to roi.quizzify.com and play with the different numbers. So you're all familiar with our cavities question on replacing fillings with silver diamine fluoride. If you think your average cavity right now costs something different from 150, you put in a different number from 150. And you can make all those changes you want to adjust the ROI. So the two things that I'm going to show you are the Doctor Visit PrepKits and the ER Sticker Shock Prevent Consent. Both of these come with the auto product, the auto quiz, auto Quizzify. I'm going to go to the PrepKits first. And this is all done on a phone typically. I'm on a big screen now for demo purposes. But for around 190 of the most common reasons to go to the doctor, whether chronic or acute, all you do, and we always say from acne to zoster, A to Z, it's really abdominal pain to zoster. You simply put in a keyword and search. And as you see, there's a zillion keywords. And I'll just show you the example of back pain. Well, there's many possibilities of back pain. What causes upper and mid back pain is different, almost always different from what causes low back pain. So let's go to low back pain. The difference between this and Dr. Google, WebMD kind of thing, is that this is, well, number one, we've curated the sources. So some sources were better than others, and we've used the better ones. But number two, this is set up exactly the way your employees would want to see it. And this is also set up so that if you have nurse navigators, they can enter their own questions in here. They're not locked in. It's not a one-way thing. So first is an overview. And as in any good website, it starts with the things that you should go to the doctor right away or call, seek medical care right away, fever, headache, rapid weight loss, et cetera. Otherwise, and this is a Quizzify thing, this is one of the things that reduces the number of spinal fusions and other back surgeries and cortisone shots, is we teach people over and over again that 80% of back pain will go away on its own. But even though 80% of back pain sufferers are convinced at some point they're in the other 20%. And we've got a link for that too from Mayo Clinic, not as clever as our language, but basically says most back pain goes away. Preparing for your visit, if it's a medical thing, the preparing for your visit will talk about collecting your meds and your supplements and noting your triggers and history and that kind of thing to make your visit as useful as possible. For back pain, it's really more about what to do while you're waiting. Don't baby your back, and here are certain exercises. Then we have questions you should ask the doctor with the opportunity to add your own or a nurse navigator to add their own. So nurse navigator doesn't have to go through every single question anymore. Most of them, the 80-20 rule is pre-populated. They just add their own. And then when you get to the doctor visit, this is how you anticipate what the doctor is going to ask you or what the doctor is going to say, and then what the doctor is going to do, test, or prescribe. Now, we do this in this particular case, doctors should not be prescribing things for the first incidence of low back pain. So there's no link to drugs.com, but where it's a medical one and there are going to be drugs prescribed, we take you right to the user ratings and reviews for those drugs to know what to expect. Then we have links to the curated sources that we feel are best for the particular topic. In many cases, you can actually play a quiz that goes with the particular topic, and you can put it on your calendar or your iPhone. So that's the part of the doctor visit of Quizzify to go. The other part is our famous, and I do mean famous, we've been in the New York Times, and we've been all over the trade media on this thing, emergency room sticker shock prevent consent that keeps your ER bills to a very manageable level. As Mark said, most of the time under $1,000. If there's a procedure involved in the emergency room, it will be over $1,000, but still vastly less than it otherwise would have been. And the simple reason for that is that we are using federal law, the Emergency Medical Treatment and Active Labor Act of 1986, to limit what they can charge you to 2 times Medicare. The typical bill from the ER is about 4 times Medicare, and there's some states where it's 6 or, without mentioning any names, it rhymes with Florida, where it can be considerably more than 6 times Medicare, New Jersey as well, California too. Then you can add this to your Apple Wallet, where it is geofenced. And when you get close to an emergency room, in my case, this is where I live, and these are all the ERs within driving distance. When I get close to one of these, it will pop up. So I'll remember that I have it. Now, the latest iteration that we have of this, instead of having to write it in, see, this is what you would normally write in, and we have plenty of people who've written it in, and then we have instructions on what to do, and then there's an 800 number if the hospital gives you a hard time, which they never do. And then there's a rebilling number, which sometimes you do need because sometimes they quote unquote forget to send you the correct bill. So we take care of that. The difference, the new thing that we have, which is semi-automated, not completely automated, is that we now offer stickers that people can put in their wallets. And when they go to the ER, they don't have to write anything down. They just stick this right on the financial consent. And we have QR code that teaches them a little bit more about what they're doing in the ER, but basically it's just a peel and stick. In the auto Quizzify, we're not going to be sending you these things, but we will send you a template for you to get them done yourself. And then, so that's pretty much the product. Are there any questions that have come in about the?
Yeah,
yes.
maybe we can, we're almost at time. Why don't we go over pricing, and then anyone who asked a question will continue and answer the questions.
Right, because I do see that we have a bunch stacked up there. Okay, so we have now taken the minimum order size down to $500 a year on a 3-year contract, even less, which allows you to get basically into the double digits of employees and still have a very affordable program. You can add spouses and domestic partners at the same price. And most importantly, since this particular webinar is aimed at advisors, once an advisor has met the minimum of this $500 a year, you can add any size group at the dollar price, even down to 25, 10, you know, I mean, I don't know how low can you go, but however low it is, you just add them right in. A typical question that comes up, we get all the time is, what does this not include that you get if you're a larger account? Well, you can customize your own questions. We'll show you how to do that, but we won't write custom questions for you. We will, if you upgrade, we can also do custom implementations. And people are always asking us, oh, you know, can you do this? Can you do a health fair? Can you, work with us at open enrollment? Yes, but it's not included. We will do custom reports, though I have to say that the reporting you get in the app is good enough right now that it's very rare that we're asked to do a custom report anymore. We have auto emails that go out, or you can send your own emails, but we won't be custom writing them for you. That's an upgrade. We get back to users fairly quickly anyway, but we guarantee if you are upgraded that you get the same day response, personalized, I might add. The stickers I mentioned, and then if in fact you get an ER bill where the consent was used and not applied, we charge a 25% contingency fee if you're not upgraded. If you are upgraded, there's no contingency fee at all. And so that's basically it. Now, stay on if you want to hear the answers to the questions, and we do have a few piled up. Mark, do you want to read them off, or I can?
Yeah, sure. Well, we have, well, Al and I are always available to do demos for any size client. And we will be sending everybody a copy of we'll send as well with the follow-up email that'll go out tomorrow. We'll send an annotated like 11 slide deck and some one pagers about Quizzify, as well as our pricing. We're always available to help with demos and we'll make sure to include in the follow-up information that we send out tomorrow enough so that you can at least introduce Quizzify. The other question is, are we integrated into other platforms? And yes, we are, and that's usually a bit of a process. So we wouldn't necessarily, and we don't really compete with Benazon or Fresh Bennies. Actually, we've had conversations with both of those companies about adding health literacy into what they do, which is onboarding and managing other kind of wellness type activities. So, but for larger accounts, Peter Prosel, our CTO, has done all sorts of single sign-ons, and we are already integrated on several platforms. So we'll kind of take that one at a time. And for any larger group, we actually include the integration as part of it. But we, you know, for a smaller group, we're not going to do that to start. We may already be on the platform, so it's something to talk about.
And I'll do the next one, which
Sure.
is what is the optimal way to get engagement? The short answer is basically the more you give employees, the more engaged they're going to be. But the sweet spot is not like a wellness program where you just got to pay people a lot of money to get them engaged. The sweet spot is to do exactly what Peter was talking about, the drawings every month. But the drawings, the key with the drawings is that every time you send, first of all, they have to be every month. You can't say, oh, we're going to do it at the end of the year. No, people like their gratification. You can't just, you can't just say you're going to do the drawing. Every month you have to announce the previous month's winners in the email that addresses the next quiz. That way people know you're actually giving this out. And then the other question related to that is about communication from above. Yes, communication when the C-suite is playing this quizzes and letting people know, yes, you will get more engagement. This is true with any of these programs, but especially this one. Any other questions coming up that I'm missing? All right, going once, going twice. Thank you, everybody.
Al, I just wanted to quickly comment on that last point for 1 second. So when I mentioned the auto raffle thing, that's actually how that's a good example of how this all ties together, because, you know, you could go through kind of a laborious process of trying to send a lot of custom communications or so on. But the thing that this auto system will do is it'll send emails monthly or twice monthly if people need reminding, if they're not playing quizzes. And some of these things like the raffle results and the raffle terms, that's what we're currently working on getting into those emails. So one of our, besides this kind of automated system, one of our other big goals for the next month or two is to basically make the emails themselves a kind of a both engagement and contest feature that also runs independently. So you know, yes, currently you would have to be the one that announced the results, but in a month or two you won't anymore.
All righty. Well, on that high note, thank you for most of you actually sticking with us past the deadline here, and we will be in touch.
Thanks, everyone.
Bye, everyone.